Hello, everybody. Gil here, and today's presentation is going to be on the priorities of TRT. Does it pay to go through insurance, or should you self-pay for treatment? Which is better and why? I want to briefly analyze the ups and downs of each treatment and let you come to a conclusion as to which one is best for you. So without bias, although I do obviously direct and run a self-pay clinic, I want to present factual information to you. This is fairly obvious information, but a lot of it is stuff that I have come across in the industry over the course of the years, both with clinical experience as well as with some of our patients who are not only new, but some transfer patients who've gone both routes and have reported some of these findings. So let's stop and think for a moment about the insurance priority. Insurance companies are corporations that are for profit. They are a business like any other. And corporations or businesses want to make money, and their profit is essentially determined by their revenue minus their costs or expenses. So insurance companies make their revenue via premium payments. So when you pay for health insurance, or your employer pays for health insurance, or even when government pays for health insurance with taxpayer dollars, that is revenue to the insurance company. You and I may not necessarily have control over that, but every time we use our insurance policy to pay for medical treatment, what we are doing is we are now creating an expense for them. Medical providers who accept insurance generally will provide a service, and then they will submit a code for what's known as a reimbursement. And depending on a scale of treatments and codes submitted, they will, within reason, receive reimbursement from the insurance company. So insurance companies have somewhat of a fixed or predetermined statistical revenue based on premiums, and then they have a somewhat unexpected but statistically predicted expense curve based on treatment. So the best way for them to increase profitability is to save money. Saving money means lowering the cost of expenses. So let's look at the actions that an insurance company would likely take in order to reach their business goal of saving money, because every dollar in business that you don't spend is a dollar you get to keep. So the first action that they're going to take is they're going to have a difficult barrier of entry. Oftentimes, patients report having to take several, 2 or 3 or sometimes more blood tests at a given time under specific conditions in order to meet what the insurance company determines as actual low levels of testosterone. And often this is strictly based on total testosterone, not taking into account other underlying factors like SHBG, free testosterone, and other cascading hormones upstream or downstream, let alone signs and symptoms that the patient feels. So what are the patient outcomes for the difficult barrier of entry? Is they are often denied therapy or treatment. So oftentimes insurance companies will deny, because remember, if they deny your treatment, they don't have to spend the money, they get to save the money, and that is increased profitability. Very common. Next is they're going to require 1 to 2 visits per month in order to pay your provider for service. Healthcare providers that accept insurance do not get paid by providing you information and education. They get paid based on minutes or hours that they spend with a patient, as well as procedures that they perform. So they input a specific billing code for reimbursement, and they may say this was a 15-minute visit, this was a 45-minute visit, we administered this type of a test or an exam, or we ordered this set of labs, or we administered an injection. So these providers are generally going to have you come into the office 1 or 2 per month to receive your medication, because not only are they going to have to bill for the office visit this way, they're also going to bill for the actual medication and injection. And they're not going to get reimbursed for more than 1 to 2 visits per month, which is why you often see patients getting 1 injection a month. And more often, you'll see 1 every 2 weeks with a lot of the primary care physicians, endocrinologists, and urologists when insurance is being utilized, because they're simply not going to pay for more frequency than that. So this is the only way the provider is going to be able to get paid, is by following the insurance frequency guidelines. This is a tremendous inconvenience to the patient. And as we know, if you want to follow some of my other videos, this is a terribly poor protocol for patient outcomes as far as medical treatment goes on TRT. Next, they're going to use outdated standards of care, and they must follow them because the insurance is the client here. They are the ones writing the check. Therefore, the provider's hands are tied to whatever the insurance standards of traditional protocols for that care is. And a lot of it is outdated. Insurance is not motivated to update the standards of care that is over 20 or 30 years old in some cases, because at the end of the day, they're quite happy saving money by treating you the way it is. And if it's done commonly enough and no one complains as the masses or the providers, then there's no reason to have a second look. Remember, TRT, as much as we may think it is mainstream, it is relatively speaking a very minute portion of the medical industry as a whole, not something anyone's really going to pay much mind to when it comes to writing new procedures. As a result, the patient suffers because, again, they're being mistreated based on old data and, quite frankly, improper protocols. They're going to chase lab ranges. Many patients have been taken off testosterone or reduced on their dose if their lab values came back above what's called quote unquote normal. Again, the insurance must paint a pretty picture on your labs in order to keep you treated. So they're often going to treat you to normalize. Seldomly will they treat to optimize. They're just not incentivized to. So again, this comes down to improper dosing, improper frequency, and improper discontinuation of treatment prematurely if any of your lab ranges come out of range. You may come back with elevated cholesterol. You may come back with elevated liver function. This may be transient. It may be unrelated. It does not matter. They're going to cut you off because this comes back to the priority of saving money. If they can get away with it, they're going to do it. So again, the patient suffers or they're simply discontinued on treatment. They're going to also require FDA approved use only. Now, to the layman term, this may sound like a really good idea. Why would I want a treatment that's not FDA approved? Understand, off-label use is very common in medicine, and some of you guys may already be off-label using medications with your provider, and you don't even realize it. FDA approves a drug generally for 1 or 2 indications, because to get an FDA approval on a drug, Big Pharma has to send this drug out for testing. This is a long, extensive, and expensive process. Once it is approved, it is perfectly okay for a provider who sees fit to write a prescription and use this in a trial basis of off-use label or off-label uses. This is totally okay, totally acceptable, and commonly done in medical practice. However, if the FDA did not test and approve that medication specifically for the indication that you are using it for, insurance will not and does not need to pay for it. Perfect example in TRT is HCG. It is not indicated for prevention of testicular atrophy or maintaining fertility in men. Yet many of our TRT patients use it, and insurance will never pay for HCG for a man on TRT. It is simply off-label use. Nothing wrong with it, but it's still not going to be covered. So remember, you are very much limited under insurance guidelines for FDA indications only, and this is going to result in inferior therapy options for the patient. Lastly, when I say uneducated provider, please don't take that to mean anything offensive. Yes, providers are educated. Yes, they go through institutionalized education and ongoing continuing education. However, it's generally a very general education with a specialty within their field. These providers, I promise you from being in this industry and speaking to many of them and knowing this industry firsthand, they do not make a living on testosterone replacement therapy. Those that accept insurance and do provide TRT service, it is a very minor and small ancillary product within their practice, not something they rely on to pay their overhead, let alone make a living. So their level of focus and attention on staying up to date on new protocols, new science, new literature that comes out in studies, and being educated with an immense amount of patience is not going to be their focus. This is essentially just an, oh, by the way, type of a treatment for them. So you're going to have a, relatively speaking, within this specialty, an uneducated provider. This is going to yield frustration from the patient when something fails and the provider is clueless as to how to handle it, and you're going to receive misinformation and backpedaling. Trust me, no offense to any providers out there, I see this firsthand on a daily basis.
Mizumi is the #1 pick to clear acne in men on TRT. Check out the products using the link in the description under this video.
Next, let's assess real quick the self-pay priorities. A self-pay clinic, much like the one that I run, let's not be biased here and let's not fool ourselves. It is a business. Businesses need to make money. Money is profit. Unlike the insurance-based models, we do not have monthly or annual premium payments that come in for a service. Therefore, we only get paid by patients so long as we retain patients and get new patients. So our priority is profit. Now, I could sit here all noble and say, hey, our priority is patient care and quality of care and making people happy. Yes, that is all true. But for the sake of argument here and keeping everything apples to apples, we focused on financial priorities for insurance companies. Let's not turn a blind eye and pretend that cash clinics are not in the business of making money. So we're going to focus on the monetary aspect of prioritizing profit for self-pay clinics to keep this on a level playing field. So let's stop and focus from a business perspective. What is the plan of action for a business to turn a profit? For starters, we must bill the patient directly. You're the one paying the bill, not your insurance company, because this is the only way we can generate revenue. The patient outcome is that you become the customer. See, when a provider accepts money from an insurance company, they are the customer, you are the product. Now you're the one writing that check, you become the customer, and the insurance company is completely eliminated from this equation. The next thing is we must retain a patient long-term, because it is far costlier to get a new patient on board than it is to just keep an existing patient on the books. How do we retain patients long-term if you have free will to choose your provider because you're the one paying the bill? Simple, we have to keep you happy. If your clinic does not keep you happy, whatever that may mean for you, could be quality care, availability, education, you name it. We all have different goals and needs and priorities, and it's okay for some people to want things differently than others. But at the end of the day, it comes down to keeping a patient happy or keeping a customer happy. So if we keep you happy, we retain you long-term. Long-term retention equals more profitability. So look at the patient outcomes. You become the boss, and we must keep you happy. This is the beauty of this business model. We have to offer all treatment options. Unlike things that are restricted to only FDA approved, we can offer off-label and we can discuss all these options with you. For starters, it gives us more flexibility in obtaining and maintaining more patients on the books. And secondly, it is more products and services that we can potentially utilize to increase profitability. So when we offer all treatment options, the patient gets autonomy, the ability to make decisions for themselves with the guidance of their provider, rather than being dictated a cookie cutter approach that is mandated by standards of care and insurance companies. You become the boss, you get to make decisions for yourself as an adult with educated guidance and care of your provider. Next, the provider-focused education. Your providers at clinics like mine are essentially making a living full-time by specializing in TRT. This is their field. This is their goal. They're not seeing a guy for a sore throat and then 15 minutes later running into a guy complaining of low T symptoms. They are focused on testosterone replacement therapy, and their education on a daily and ongoing basis is not only what is mandated for continuing education credits, but it is significantly heightened by self-awareness and a desire to excel and self-actualize into a better provider, not only to do better for their patients, but again, increase profitability. So you're going to have a far more focused and specialized provider treating you, and this means an educated patient. Because our goal, specifically my clinic, I can speak for, we focus on patient education. Patient autonomy comes down to making your own decisions, and if we don't give you the tools and knowledge to do so, then you're shooting in the dark. So we want to educate patients as much as possible, and that is why our providers receive continual education. And as data comes in, and as case studies come in, and anecdotal data comes back from patient feedback, if we need to make a change to protocol or have conversations, the patient benefits from that education. Next, low volume feasible business model. The participating provider, or what we call an insurance-based provider, must see 40, 50, or sometimes 60 patients per day in order to bill enough office visits to maintain a business. Now, that means 10 to 15-minute visits with a patient, and they must run out the door. You know very well that you've been at your provider's office, especially primary cares or urgent cares, and outside of the medical assistance and occasional vitals from a nurse, the ability to sit down with the actual provider is going to be limited to just a couple of minutes. And quite often, people go in and they don't even get to see the provider. The provider just gets a couple of quick notes from their assistant, and they make a determination in the hallway and they run into the next room. So the low volume business model means that we could see 6 to 8 patients per day and dedicate sufficient time. If you need an hour for your consultation, or if you have questions midday, your provider is available to answer. So this equals prolonged patient attention, which is key to everything above this point, including education, keeping the patient happy, and making sure that you're fully autonomous. Patient-centric care plan. We're going to develop a plan around the individual, not around their lab numbers. We're not trying to satisfy some crazy range in order to meet an insurance requirement. We're looking to solve the signs and symptoms that are associated with what brought the patient to the clinic in the first place. If it means that the lab ranges fall into a particular range, that's great. If it means we need to deviate from that standard in order to make sure that the patient feels their very best, while making sure that we're mitigating any potential risks or adverse side effects, that is what a patient-centered care plan comes down to. And this gives you limitless options for your desired goals. You define your desired outcomes and set your goals. Your providers will put together a patient-centric care plan and then educate you on that process and come to an intervention understanding together. And then lastly, self-administration. You're not going to be inconvenienced to come into the clinic once or twice a month. You're going to be educated on how to self-administer your medications at home. Your provider should be on speed dial in your back pocket at all times for any questions or concerns that come up. But remember, self-administration comes back to patient autonomy, extremely important. So this not only allows for far more convenience, this also dramatically improves the ability to adjust your frequency and your protocol on the fly to meet your desired outcomes. Lastly, insurance. Their goal is to save money and avoid patient care. Remember, the more people they turn away, the more money they save, the more money they save, the more money they get to keep, and the more profit they reap. So avoiding care is the priority for insurance to maintain profitability. For self-pay clinics, they also want profit, but the quality patient care is what drives that profit. Quality patient care means longevity and retention, referrals, and new business on an ongoing basis. If the quality of patient care is dropped, the profit is reduced. So think from a patient perspective. Do you want to be prioritized financially by a company who is looking to avoid care, or a company who is looking to initiate quality patient care for the same end result financially? If you find value in my videos and you have more questions, feel free to visit my website at nextleveldietetics.com. You may book a one-on-one personalized consultation with me, and if deemed feasible, I am happy to direct you over to my medical office. We do offer telemedicine services throughout the United States where we can treat, diagnose, prescribe, and continue to monitor and consult with patients on an ongoing basis throughout the United States. So feel free to head over to nextleveldietetics.com, have a look around. Feel free to book a consult with me directly if you'd like, and we can discuss moving forward into a patient relationship via the clinic. Thank you so much for your time. I appreciate you watching this video. Feel free to comment below and let me know what your thoughts are. Take care.